Hello there again, Tony Mecham, Oral and Maxillofacial Radiologist, and this is the third video in a series on bone healing and pathology. So today I'm talking about calcifications within the temporomandibular joints, and this could apply to any joint really. So what are the different causes of calcifications in the joint? Let's talk about that. First of all, the most common disease of joints is osteoarthritis. So it does follow that the most common cause of calcification might come from osteoarthritis. And so these are joint mice. Occasionally osteophytes, if you can imagine these long expanding osteophyte projections off the surface of a joint, they could fracture off. And then those just get stuck in the joint cavity, the synovial cavity, and that's what leads to joint mice. And so how do you determine these from other forms of calcification, other causes of calcification? Well, look for signs of osteoarthritis. This one, obviously, there's sclerosis throughout the condylar head. It looks like a little osteophyte here. You can easily imagine how these are just osteophytes that fractured off from the joint, and then they're just hanging out in the joint space here. Can be painful, but osteoarthritis itself can be painful. So it could contribute to it. Maybe it could contribute to some limited mobility in the joint, but really that's all there is to joint mice. All right, so I want to talk a little about gout and pseudogout. Gout doesn't often affect the temporomandibular joints. Pseudogout isn't super common either, so good to know both of them. Chondrocalcinosis is another term for pseudogout. So the only difference between these two is the type of crystal that's depositing within a joint space. Gout is uric acid crystal depositing in the joint, very painful, more common in males. Usually it's going to affect the first joint of the big toe, so right there. This happens because of reduced excretion of uric acid in the kidneys, and that can build up in the joints for whatever reason. It affects the foot, the toe first. But it can be secondary to diabetes, which causes this, obesity, sickle cell anemia, and some other things. Pseudogout, on the other hand, is calcium pyrophosphate deposition disease, is another term for it, or CPPD. This can also be secondary to diabetes or hyperparathyroidism. And so those could look similar as you get accumulation of little crystal deposition in the joint. It might start to look cloudy. These are examples of gout. Not pseudogout, but gout. See how it looks like small calcifications around the elbow in this case. As I said, it typically invades the first joint of the big toe. We see erosion, so gout can be erosive. It can erode into a joint surface. And we're seeing little calcifications, right? It just looks kind of cloudy, or kind of what we call ground glass, that appearance. It's because it's small crystals inside the joint space causing it. And then when they have a big nodule, gout is kind of known to form these nodules. They call this a tophus. This one's a huge one, but very painful. And the big thing to notice is the kind of ground glass appearance within the joint space. We'll contrast that with synovial chondromatosis, which is a benign disorder. And this one does behave more like a benign tumor, but it causes metaplastic formation of cartilaginous nodules within the synovial membrane or within the joints. And those nodules tend to calcify, and this causes larger discrete calcification. So it looks like little pebbles inside the joint rather than your gout or your pseudogout, which causes more crystal deposition, which is more of a ground glass appearance. So that's the major difference there. This one a little more common in females. It can cause symptoms, maybe not as symptomatic as you would expect for gout. Usually this is going to be unilateral. As I said, think of this like a benign tumor, but it's a tumor that develops these small calcifications within a joint space. Here's an example. If I showed you this image right here, how could you tell that it's not a joint mouse? What did I say about joint mice? Those are small little osteophytes. Those are associated with osteoarthritis. This condylar head looks nice and uniform, the cortical outline of it, nice and smooth. No signs of osteoarthritis in this case. But you get these small little pebbles of calcification just around the joint space. That's your synovial chondromatosis. Even easier to see if you have a 3D view. Here's our sagittal view, showing these small little pebbles or little islands they almost look like bone, but islands of calcification just around the joint. That's your classic synovial chondromatosis. They also call it osteochondromatosis. So remember the term chondromatosis because they're referring to this disease. Okay, so if I show you these images, on the left here, we have a knee joint. What type of calcifications are these? Are they those small nodules that I just showed you, or more of kind of a ground glass? Think of crystallized calcifications in here. Yeah, this is more your gout, or in this case, pseudogout, chondrocalcinosis. And so I have these two different images, axial slices through the temporomandibular joints. The right joint is affected in both. Here's your right condyle, nice smooth outlines. Maybe we don't see all of it in one slice, but nothing about this shouts to me that there are degenerative changes. And I see these small islands of bone or pebble-like calcifications within the joint space, contrasted to this one, where it's more of a diffuse, almost a ground glass or maybe a cloudy appearance of the calcification. So which is which here? Which one is the chondrocalcinosis? That should be this one right here. And then down here, what did we call this? Synovial Chondromatosis. And so they should be fairly easy to distinguish. Not always that cut and dry, but be able to know kind of the major points about them. All right, I wanted to close out this video with this table that summarizes the different causes of joint space calcifications, particularly within the TMJ. We covered those first four in detail earlier. Joint mice are just loose bodies tied to degenerative joint disease, so always look for signs of classic degenerative joint disease. Synovial chondromatosis, remember those pebble-like calcified nodules? That should be a giveaway for that disease. Pseudogout or CPPD, and the only difference from that really is the type of calcification, although CPPD is a lot more common in the TMJ. It's also really common in the cervical spine, so that's something you'll see posterior to the odontoid process of C2 in some cases. And so pseudogout is a good one to recognize. Gout itself, as I said, is somewhat rare in the TMJs. And the only real difference you need to know between CPPD is uric acid deposits. And so pseudogout affects more peripheral joints. Remember the big toe, the knee, those are kind of common locations. And the rest of those items in the table are much less common, but it's still worth knowing if you're reviewing CBCTs. Certain tumors can produce calcifications that can settle in or around the TMJ space. Rheumatoid arthritis, in rare cases, might lead to secondary joint calcification. And of course, intercapsular fractures can leave behind calcified fragments of bone or debris within the joint. Then it's good to know that systemic metabolic conditions such as hyperparathyroidism, diabetes-related issues, renal failure, sometimes other disorders can cause widespread calcium deposits that sometimes involve the joint, so including the TMJ. So when you spot unusual calcifications on imaging, I'd start with those common ones up top, the ones we discussed, but keep those rare differentials in the back of your mind, especially if the history or other findings don't quite fit the usual patterns. And that's it for this lecture. I'm going to leave you with a thought, and that's a Harry Potter thought. That Barty Crouch was the best teacher Harry Potter ever had, if you think about it. He taught him unforgettable lessons. Here he is giving a direct hands-on lesson to a student about what happens when they break the rules. He taught him the unforgivable curses, so active learning. He was up close and personal. It was like classroom as a student. Taught him how to resist curses, early experiential learning, all the good things. He was a great teacher.